Hi everyone. Thank you for joining today's session. It's a very important topic that we want to discuss today. With most parents of young children, I was talking to Dr. Chetan a couple of days back, and we were just saying that as parents of young children, whenever they have a slight cough or a cold, we are first to run to the pediatrician. We are first, to do all the tests that are required to make sure that the child is physically okay and gets the right medication, the right treatment, the right diagnosis, and is fine. But what happens when there are certain behavioral issues, or when there is like an emotional disconnect, or when there are mental health developmental issues in children, and what should young parents kind of look out for? What is the kind of approach that they should adapt to kind of recognize what are these issues, to recognize what should be done, such that you kind of, um, stop the issue at a young age and not let it go, progress as the child gets older. So we wanted to discuss a few mental health issues affecting young children today. And joining us, we have Dr. Chetan Nerkar. He is a psychologist. He sees a lot of families. He treats a lot of young children. So he's just joining us today to kind of shed some light on, what are some of these issues and how can we as parents recognize these issues and then take corrective steps to reverse them, to make them better. So, hi, Dr. Chetan, and thank you so much for joining us today.
Hello, Jaisal. Good afternoon, and thank you for inviting.
Thank you so much. Dr. Chetan, we will, start with the basics. If you can tell us, so here we have members of our community which usually have kids between the age of 2 to 12. So we are
Okay.
not really addressing the very small infants from 0 to 2, but it's more from this age group, which is 2 to 12. So can you shed some light on mental health issues affecting this particular age group, and what do you see, the most in your clinical practice?
So, this 2 to 10 years is a very important, or 2 to 12 years is a very important age group in terms of development, not only physical development, but also the mental development. And the participation of parents is the key for the developmental success of any child. So
Nice.
that is very important, and I would like to tell you a short case where recently this the student was referred from the school. Generally, we get the cases when the teacher or the school or some they can have a complaint of the child, and then they tell the parents, and then the parents think about it and they come to us.
Okay.
So this case, a 6 years old child, and he was not at all sitting at one place. Means after the COVID, we have seen rise of lot of behavioral and developmental issues among the children. But what has happened in this case is already this child was having some concerns at the age of 2 or 3 years, which was completely not diagnosed. And as you rightly pointed out, Jaisal, we have to catch it very young.
Yeah.
If
Yeah.
we catch it very young, then we can have a lot of therapies with the child, with the parent, and then the things are very smooth in the long run. Now, this child was referred, he was not sitting at one place. Second thing, he was not at all entering into the school. He was constantly crying. So he is a 6 years old child. So he was just entering into his first grade one, first grade. And 2 years of lockdown, so no school was there, everything was online, and he was not able to cope up with three things. First, new environment. Second, lot of students in a school, there are many students, so he was getting that anxiety, that fear. And third, he was not able to communicate. So these three things are, and then he was pushed, he was forced to enter into the school. And once he was forced to enter into the school, he was not at all ready to sit, because he was not accepting the new environment.
Yeah.
So
Yeah.
again, what we do is we try to fix into that box sit in the class, sit on the bench, try to
Yeah.
listen to the teacher, write it down, take out your notebooks. But then he was throwing temper and tantrums, and then lot of issues. Started biting the other kids, started
Oh.
spitting in the class, started pushing the teachers and other colleagues. And so he was making his environment safe according to his rules.
Understood.
So this case gives us a few points that post-COVID, there's a lot of rise in behavioral problem first. Second, anxiety is a concern which not only is in adults, it is among the children also. But
Yes.
the manifestation of that anxiety is in a different ways. What we see as a parent or what we see in the practice, the only manifestation which teachers or the parents see is through academics. That is, his marks are reduced, or his behaviors, or he's not good in the school, not behaving good in the school. But there are lot of other concerns which are affecting the children.
Sure.
So so going ahead, then can you share the
Yeah,
slides?
yeah. I'm just going to share my screen.
Yeah.
Yes. Can everyone see my screen?
Yes.
Yeah, Dr.
I can
Chetan?
see this.
Yeah.
Yes, I can see it. Yeah.
Okay, perfect. So, Dr. Chetan has just put together some slides. These are mental health issues in young children. So, I'm just going to go to the next slide. Yeah.
Yeah. So, participants, very good afternoon, and very important topic, that's mental illness in children. So illness refers to the negative term. Okay, it sounds very negative. So when you consider illness, first we have to understand mental health of a child. So if we consider mental health of a child is very important, then only we will try to find out how this illness will not creep into our child. But there are certain signs, certain disorders which are among the children, which we can identify early, or we can change through various techniques so that our child can cope up with the environment.
Sure.
So first you can see his reactive attachment disorder. Now reactive attachment disorder is it is a disorder where there is no emotional bonding of a child with any of the caregiver. Now, when I say caregiver, it can be mother, it can be father, it can be any other else person. So, any caregiver, there is no emotional bonding.
Okay.
This leads to lot of resentment in the child and resentment in the caregivers, because they are not able to understand how is this child going to react, because he has no reaction itself.
Sure.
There is no emotions which he can express.
Sure.
Now, why this happens, we will see it later.
Yeah. Yeah.
I will
We'll
just
go
give a
into the
brief
slides.
slides. Yeah. Then there is an anxiety disorder, as I explained. Then there is a depressive disorder. Depression is a very common term which we use in day-to-day communication. Like, I have a depression, or I am feeling
I'm
depressive.
feeling depressed. Yeah.
Yeah, I'm feeling depressed. But
Yeah.
in the children also, there are signs of depressive disorder which has to be catch earlier.
Okay.
Now these three disorders are actually the disorders very related to the child's mental health. And the next three are actually related to the activity based. So hyperactivity means physically hyperactive. That is actually a disorder, but it is a manifestation. Then behavioral disorder, again, behavioral concerns, which I referred in the case. There are a lot of behavioral, like spitting, not obeying the what the teacher says, or not sitting at one place and not listening to what the parent says. So behavioral disorder is something which has different causes. Okay, it can be anxiety, it can be depressive, it can be reactive attachment disorders. Because of that, behavioral concerns may arise.
So
And
you
the
would say
last,
that anger and aggression also is behavioral disorder, right?
yeah, but we see only anger, we see only manifestation.
Okay.
But the cause might be anxiety, and the cause of anxiety also might be reactive attachment disorder.
Okay, understood. Yeah.
Then the last is a developmental disorder. This is a separate set of disorder where there is, as the child grows, the developmental concern starts to arise. like selective mutism is there, autism is there, or hyperactivity, ADHD is there, attention
Okay.
deficit hyperactive disorder is there. So these are the developmental disorder. There is a set of behaviors in this developmental disorder which needs to be treated scientifically, identified early, and parental support, teacher support, and counseling is very important to cope up with this disorder.
Yes.
So we will see how this reactive attachment disorder, exactly how it affects. Now, what is reactive attachment disorder? It is lack of emotional bonding, no emotional bonding. So why this happen? Because there is a complete neglect of a child from the family side. Now, when I say family, means parents.
Parents.
So either it can be a nuclear family, it can be joint family, but there's a neglect, means he will do it, or let him do what he wants. Okay, so there is a neglect part. Then there is a parental care. So lack in parental care. I don't say that yes, you need to give 24 hours, you need to pamper your child. No, but there has to be a like there is a thin line between what we do normal, optimum, and what we do excess, and what we don't do it. So that thin line has to be maintained, and this
maintaining that balance between work life, taking care of your child, finding enough time to do everything. And I think that as a new mom, I can tell you that 0 to 2 or 0 to 3 is when we need to focus maximum time with that baby, so that because that's when their brain is developing, right? And a lot of research indicates that it's directly proportionate to the amount of time a child gets with the mother or the father or both in 0 to 3 actually dictates a lot about their mental health for the rest of their life.
Absolutely right, Jaisal. And I will say that it's not only 0 to 3, but we can extend it to 0 to 5. So it's very difficult. 5 years of parents, it's on the stake. Okay, career is on the stake. A lot of things are at stake. But that is what it is a good thing that you have a child in the family. There's a lot of positive things. There needs to be some sacrifice. There needs to be some compromise. But again, I will emphasize on mother and father, both care has to be important. Not only mother's role, but father's role is also that important. And then inconsistent multi-caregivers are there. So sometimes what happens in the urban city, like, or metro cities, there are a lot of other caregivers as per the time. So 9 to 5, 9 to 11 is somebody else. Then 11 to 2, the location changes. Then afternoon, the other grandparents comes in, and then evening, again the parents come in. So these inconsistency, multi-care things also sometimes affect the child.
Understood.
Yeah, and then no positive emotions. Now, positive emotions, the child always thinks negative, or always opposes, or whatever you give him, he will throw it out. So that kind of emotional negative turmoil is going in the child's mind. Fear is there, anger is there, tantrums is there, and these fear, anger, it's very difficult to identify in a young children. After once he starts to go to school, yes, it is identifiable, but little less than that, 3-4 years, child has it. And that also, if we can catch it, then we can actually treat it very in a holistic way.
Understood. So what would you say would be some of the examples, like for a child who's under the age of 4 and they are not very articulate when they can tell you that they are scared of something, for example. So how do you, as a parent, really spot fear or the traits of fear in a very young child?
So sudden irritability of a child.
Understood.
So whatever the pattern of your child is, a mother or a father knows, and there is a sudden change in his actions, sudden change in his behavior, suddenly starting to have a lot of irritability. There are a lot of suddenly the things are happening somewhat weird in your child's case. Then yes, something is wrong, something is missing. Then you need to sit, you need to observe your child, wait, watch. 2 W's are very important. Wait and watch. Observe your child. Try to talk to him or her. Don't like give your concerns that what is happening. Yeah, this has happened or that has happened. No, just try to understand how his days have been. If you are not at home, what has happened. who came, who went away. So a lot of exploration is required. That exploration itself creates a bonding. Once that exploration is done, that bonding is created, automatically that fear, that anger, that sudden changes which have been identified, that will decrease, because child will feel safe in that environment. But if we question the child's behavior, why he is doing that, you should not do this, this is not a right behavior, then he will feel more unsafe. And once he starts to feel more unsafe, he will go into the more shell, or he will break all the shells.
Understood. So it's important to identify what is triggering him, as opposed to asking why is he behaving like this.
Yeah.
Right.
You may not find what is triggering, but the process of finding itself can help the child to arrive at a certain conclusion by himself or herself.
Okay. And then feels more secure because he knows that you are there for him, and you know, that he may not necessarily need to feel so scared.
Yeah, absolutely.
Understood.
Yeah. So continuing from that scare word, Jason, that fear, that scare, if it is not addressed, it turns out to be anxiety.
Understood.
So there are different types of anxiety in the children. So separation anxiety is the case which I have told you, when the child like refuses to go into the new environment, or especially refuses to go into the school. So he will go to all the places, but once you reach to the school gate, he will either have vomiting, he will either have abdominal pain, he will just cry, and he will not go to the school, and just you have to bring him back to the home. And this happens on a frequent daily basis. That is what he doesn't want to leave the mother or a father or the parents. Okay. So it's very insecure. Like what will happen, because in that environment, who will take care of them? So that is separation anxiety. Then generalized anxiety is the next part of it, where consistently, if the child is put into that anxious environment, he will start to believe that this is what the life is, and this is how we have to live it, with that anxiety and with that fear. And that in the developmental phase, it goes into their lot of physiological symptoms, like sometimes enuresis is happening, that means involuntary urination, or encopraxis. Sometimes the child may have stools in the school itself involuntarily. So that is all related to the anxiety.
Understood.
If that is not addressed at that level also, when the child enters into the adolescent age, that is 12 years, post 12 years, he goes into that phobia. So there is a complete fear of things. And then there are multiple stages of that illness which goes ahead. If we can identify at the first level itself and treat it scientifically, I think the other problems will reduce it.
Sure. Since we are on anxiety, is it also common for you to see social anxiety in young children? Which is, you know, like a lot of children are comfortable in their home environment. They may be even comfortable in school. But the minute they are in social settings, whether it's a birthday party or it's a new relative's house, not just when they are toddlers, but when they have grown up quite a bit, they're very shy. They stick to the mom or the dad, you know, physically. They don't want to interact with anyone else. And we know that social anxiety in adults is you know, is spoken about, you know, when you don't feel like going for a particular event or a party, it gives you a lot of anxiety before going. But do you see that also in young children, where they just don't want to interact with anybody else?
Yeah, so we see that kind of concerns, that they don't want to talk, they will just stick to their parents, or they will refuse to go to the parties, but they will go to the school. But if you take the history, the starting of the school might be difficult, but once they are into that system, they are adjusted to that system, then they have that reduced anxiety.
Understood.
Party functions or any other gatherings are very new to them. So going to the new place, meeting the new people and a crowd is often makes them feel very anxious. They don't know how to react to that situation. And yes, I do see such cases. But then again, I see it in a different context. There are again two things, Jason. We should not overdiagnose also,
Yeah.
and we should not underdiagnose also.
Yeah.
So by evaluating with certain tricks, with certain parental training, that anxiety can be reduced of a child.
Sure.
Okay.
Sure.
If not, then it turns out to be general anxiety.
Okay.
So yeah, going ahead, depressive disorder. Yes. How do you find your child uh, is having a depression or towards the depression or depressive like symptoms? So he's often tearful. So he constantly cries, he or she cries whenever they go to school, come to the constantly cries. Means whatever you talk, they will cry. Lack of desire to play. So when you go to the garden or when you go to you are trying to force them, but they are not interested in playing. They are interested in watching others. They are interested in something else, but not play. So that is the one sign we have to look for. Decision making difficulties. If you can see that image, that they are not sure what to do. So if you give them a free play, they will just think about it, whether to do this, whether to do that, but they will not actually do that.
So tough to be indecisive and not action oriented. Like they cannot take action.
Yeah, they cannot take actions.
They cannot take action.
Yeah, post COVID, we have seen these concerns very much, that they just think because in the COVID everyone was at home, so they started to only actually imagine the play, but not to play.
Yeah.
So this is what the play is, but how that play has to be done, they don't know.
Yeah.
So that is what decision making difficulties. Then shame, self abasement, like thinking about own body. This can be around 6 years, 7 years, when they start to explore their own body, different parts. There they shame for themselves. That I'm not good, I don't look good. They start to compare, and when they compare, they make themselves inferior. They think themselves inferior. So this shaming, often sitting at one place, not interacting, tearful, not having a desire to play, lack of decision making difficulties, lack of like changing food habits. That means earlier the child was eating regularly, then there is a sudden rise in the eating habits, or there is a sudden decrease in the eating habits. So he's not eating only. So these are some of the things, and all these things, if they're consistent for at least a month, then only we need to have that concern in our mind. Otherwise, these are the common things which often every child encounters, or every parent can see in the day-to-day life of their child. So it doesn't mean that their child has a depression. No. But if it is consistent for over a period of month, it is starting to affect their functioning, then yes, we need to address that.
Yeah. Similarly, like how we as adults, when we go through phases in life, right? We go through ups and downs. There are months where we may feel not like ourselves, and then there are months where we are absolutely fine. So if we see that this is becoming a trend, and we feel that we are constantly in this state of mind, physically, mentally, then we seek out help. So similarly, before we attach a particular disorder or a disease as a label on someone, we should first see if this is happening for a good month or two, and see if it's a pattern, and then kind of attach. Because these days also, what has happened with mental health awareness, because all of us are spending so much time online and we are exposed to so much content on Facebook and Instagram, that a lot of the people who are sharing their views about mental health illnesses, they are not actually psychologists or psychiatrists. So, but when you watch a video about something, you feel that that is the truth. And then, we start attaching labels. Like if there is a kid who is slightly more hyper, then you automatically say, oh, he has ADHD. But, we are so quick to attach labels now, but it's very important to see if that is a longer pattern, or is it just a momentary thing? Something has changed in the house, something has changed in their environment, which is making them be like that.
Right, absolutely right.
Yeah, it's very important to distinguish between the two.
Right, yeah. So very important what parents need to do. So next. So build the confidence, encourage your child to keep on trying, show your child that mistakes are okay. This is very important.
Yeah.
That it's okay if you do the mistakes. Be the strength detective. Means try to find out the strength of your child and
Yeah.
use that as an reinforcement every time. Give your child a lot of time to play in this competitive world where
Yeah.
we try to focus from the grade 4, 5 about thinking about JE and NEET and all that stuff. Uh, so please
No, I
try
think
to
it starts from playgroup.
play
It
group.
starts
Okay.
from playgroup level. I know my son is in playgroup, and I see, there's this constant talk about sending the playgroup children who don't even know ABCD. They just go there to play. To, let's put them in dictation classes. Let's put them in spelling classes. Let's put them in rapid maths classes. They
Yeah.
barely know how to count 1 to 5. So there is this hyper competitiveness that parents are indulging in, which is also getting projected on children, right?
Yeah, absolutely. We need to have optimum word is very important here.
Yeah.
Do lot of things to the child. I agree. As a parent, you want to do because
Yeah.
either you will have one child or two child,
Yeah.
two. So you want to give the best of it.
Yeah.
Give the best, not in terms of numbers. Okay. So try to find the one strength, and
Yeah.
it everything has its time. Okay. So as you said that they don't even know the numbers, and we are putting into them
Yeah.
some maths class or something.
Yeah.
So they will definitely miss out on lot of things of their life.
Yeah. Yeah.
Help your child to be assertive. That is very important. When you are assertive, you try to first do it, then automatically the child will do that.
Yeah.
So confidence building is a very important measures which you can you yourself, if you do as a mother, as a father, automatically you will also feel good, and automatically the child will also feel safe.
Yeah. Yeah. So I just
Next.
want, this last line really resonates with me, which is a lot of people tell me as an individual that I'm assertive, but I'm not aggressive. I,
Okay.
there is a very fine balance as parents, because what happens is that we come across as assertive or aggressive at times, but we are not okay if our child does the same thing. We are not okay if our child puts forth their opinion on something, whereas we are constantly putting our opinions forth for the child, right? And when you don't give them that environment for them to be assertive or for them to be confident and say what they want to say, uh, I feel like that impacts their self-esteem growing up, right? And that then can lead to an anxiety disorder because of low self-esteem, or a depressive disorder. So this assertive word is very important. We need to, as parents, allow for our children, even if they are toddlers, even if they're just 2 years old, to have an opinion and to be able to share that opinion. Whether you take it into consideration or not is a different thing. But if we don't even let them voice their opinion, then they're going to grow up to not be very confident,
Right.
as individuals, and that's the root cause of a lot of mental health issues.
uh, Taking ahead your thought, Jason, uh, child's opinion, yes, they do matter.
Yeah.
Child needs to be speaking about it. Also, sometimes child just talk something weird,
Yeah.
something his own thoughts. So we need to just listen to
Yeah.
that. Okay. It might sound, or he might react to what is happening in the family. So we will, as a parents, take it as a negative thing. Oh, you should not speak like that. Oh, you should
Yeah.
not do like that. So we try to fix into the boxes, or we call it as a social norms or the family norms.
Yeah.
But we need to also at the same time tell that child there are family norms, there are some rules, there are some regulations, but it's okay if you speak to your mom or your father.
Yeah. Yeah.
So that space has to be given. At the same time, they need to understand what are that, how to go about it, how to speak it.
Yeah. Yeah.
Responsibility and participation. So yes, all parents are responsible these days, but they are excessive responsible, but they really lack participation. They want the child to participate into other things where they will only give the environment, but they will not actually do that. So if your child says to your father that please play with me, but then everyone is so busy that you will say later on, later on,
Take
later
this
on.
toy and play by yourself.
Yeah, take the toy. Or if nothing is there, then we have a gadget. So take the gadget and play. Then I will afterwards when I get time. And yes, life is very competitive for the parents. If they don't answer the call, their job is also important. The work is also important. Emergencies are there. But then somewhere we need to keep it in the mind and try to take the time for the child. So give your child the responsibility of the small things. That is very important. We sometimes underestimate our child. So give them responsibility. Small things they need to take care. Even if they make a mess of it, it's okay. Supporting participation is very important without thinking of result. Okay, so now these days, if there is a simple drawing competition, so everyone wants the child to be the top in that, or simple elocution competition, then every child wants to be the best. Okay, it's okay. What is important is participation is important wholeheartedly. Okay, don't try to put your views or your thoughts into any of that activities. Let the child explore and come out with his own thoughts and activities. Encourage to help others. That is very important. Help your child to learn values of your culture. Social participation is a key for making child feel independent and responsible. As we discussed earlier, social participation, if some child is having anxiety or lack of participation into the groups, then yes, then it is a responsibility of the parents to make sure that every week or every fortnight, they will take their child to some group, some where a lot of people are there, and try to make him talk, try to make him converse with the support of them, so that they will feel safe and break that barrier. So when parents show affection and for all the parents, when you show affection and attention, child will exactly feel loved and connected, and he will have a sense of worth. If you listen and understand, he will feel accepted and he will understand others also. Otherwise, he will not understand others, he will not listen to others. If you stay calm whenever there is a fight, if you stay calm, they will calm themselves and handle the situation. If you react to that situation in their family, automatically child will also react in the same way, and and that child will also tell you that this is how you have reacted earlier, so I also did the same thing. This is what child says. So this is very, and then the parents are, oh,
we were having this conversation on our community a couple of weeks back, and one of the mothers posted that, I have a 6-year-old daughter, and we live in a joint family, and whenever she argues with me, I tend to argue back, and then it just becomes like this match where you're just arguing back and forth. So, and what was surprising to see is that a lot of women then were in support of that, saying that yes, she's a girl, and she should know how to argue for what she believes in. And my takeaway from that was that your child is going to mirror you, and while it's fine to let your child convey the what she needs to, what is pent up inside, if you do the same thing back at her, none of the two parties are listening to each other. Your daughter's blocked your sound out, and you have blocked out your daughter. So all you're doing is you're just basically mirroring, she's mirroring you. And you're just talking to a mirror, and nobody's really registering anything. So while we allow our children to, actively come and tell us whether they want to raise their voice, whether they want to argue sometimes to really put forward their point, it's also important to not do the same thing back at them. Parents think that that is completely okay, and that is how we teach our kids to be strong, independent people, where they can really talk about what they feel like. But it is not healthy to have a 6-year-old get into argument matches in a household. So handling it, the last point is extremely important for parents, because they will be in a situation in a house where they are having arguments with their own in-laws, their own parents, even between a husband and a wife. But then some of them are not okay if their child depicts the same behavior, right? But they have to understand that they have picked it up from you.
And parents will not accept that they have
Parents
picked
don't
it
want to
from me.
accept that.
Yeah. So very important that message to the all the parents, including me, that whatever your past emotional baggage, whatever your past traumatic events in your life, don't try to pass on to the child. Try to heal yourself. Okay, don't try to take the child in your healing process. Okay, he's a different individual, he's a different entity altogether. So as a parent, that is where the first 4 5 years are very important. You have to give the time to yourself, to your child. Make yourself calm, address your problems first. Automatically the child will not have any problems. Show patience. That is very important, which everyone lacks, every parent lacks, because they have to go to the time, take the bus, go to the office, take a lot of things, traffic, everything. So wait and develop the patience. So very important, like patience can be developed, these are the small, uh, what we call it as, opportunities, daily opportunities, a small opportunities where we can do this. Patience, it's not like instantly, now today I will make my child understand patience. No, it doesn't work like that. You have to be very, very smart. You have to be very proactive and at normal levels. Okay, smart means normally smart, so that you teach every moment or get every moment into that teaching thing. So few teaching moments every day occur. If you cross a road, yes, make your child develop the patience there. Wait, how to cross it? Wait, we have to wait. Okay, automatically the child will start developing. We have to wait to cross. In the same way, you have to relate that same thing. We have waited, we have not gone physically to cross the road because some vehicles were there. In the same way, if somebody is talking, we should not talk in between unless he finishes off. That is what the patience are. So just a small communication can lead to lot of understanding into the child. So show patience and try to find out that beautiful teaching moments every day, every moment, and teach your child. Show a positive outlook, appreciate positive, and problem solvers. Means, once a positive outlook is there, automatically make the child will develop the problem solving skill instead of thinking about the problems. View mistakes as okay. This is very important. It is a part of learning that will make the child to try the new things. If you want your child to be always perfect, then that is absolutely. Always believe that a child should be always imperfect, because the more he is imperfect, he will always try to explore more and try to do the new things. And that is what innovations are.
That is such a beautiful line, to always focus on making your child imperfect. I think that should be the motto of every parent raising children right now, is that we are all hyper competitive, our professional careers are competitive, getting into a good school, good college, everything is competitive, and in that race we project our need for competition and achievement on our child. And it's so important to just let them be imperfect, and try, like, be like a jack of all trades. Let them do a bunch of things imperfectly, then do one thing extremely perfectly, right?
But that will take time. That they need to understand. It is not that every grade mark sheet reflects that. That is not the actual we should look for. That is okay. Whatever the marks are, okay. Academics, it's okay. So thank you, everyone. Questions?
I'll just stop sharing my screen.
Yeah.
Okay, so participants, please, if you all can write down your questions in the chat box, and I will just unmute you all. Just give me a second. Okay. So actually, we had a few questions from our WhatsApp community. I'm just going to take you through those now. One of them was, like we discussed, temper tantrums is pretty common in this younger age group between 2 to 10. So if you can tell us, a bit about temper tantrums in young kids, and especially when they see other kids throw temper tantrums, is when they want to also do it.
Yeah. So temper tantrums means excessive irritability, okay,
Yeah.
and not wanting the things which parents doesn't want to give or not expected for the child to do at that age, and they want it. For example, uh, children, they generally do a scene when they go to the mall. If they want, they will just sit, lie down, make a lot
Yeah.
of mess in the mall, and parents feel so awkward that they whatever they want at last they get it.
Yeah.
So here comes the first lesson. Try to increase your patience to that level that even if you feel awkward, it's okay. But as a parent, if it is your decision of for the child to not to give it because it's not a right time, not a right moment, not a right thing to do, then it's your decision. Child should not control you. You should handle child.
Yeah.
Not control, but you should
Not
handle
control.
the child. Yeah.
Yeah.
But what happens? Temper tantrums make feel child they can control the parents,
Yeah. Yeah.
and then they will do each and everything till that moment they will reach that barrier. So best way is to have patience, but as a parents, if you have decided no, means stick to that no. If yes, then yes, you have to do it, means you have to do that.
Understood. There is one question saying, I have a 6-year-old daughter. She's always thinking about others and not herself. She's at times having school anxiety and gets disturbed when things are not happening as per her will.
Okay. I would like to have some more points of
Yeah,
her
actually,
because
this was
yeah,
on the group. It's fine.
group.
We can
Okay,
actually
okay,
take some
yeah, but
my hmm,
just two lines for her, if for that mom, that if this you said that school anxiety and she is disturbed and she thinks of the other, then yes, this is something worrisome. We need to evaluate, take the help of a professionals to rule out something.
understood. What is your opinion on single children? A lot of us are having one child now, and one of the mothers on our community had said that I have a single child. He talks normally at home, but when he's out, he doesn't mingle with others. He doesn't want to play with other kids. He's 6 years old,
Mhm.
and both parents are working. So, what are, and even my child is a single child, and we don't plan to have another child. So, what is the difference in your mind between a single child and, a home which has two children? Do you see a behavioral pattern that is very specific towards single child?
Yeah. So, what, I also have a single
Okay,
one
great.
child. So
Okay.
yeah. So, see, in Indian context, we have to see into the Indian context,
Yeah.
and what the research says, what the evidence says is that when you compare the developmental patterns of a child who is a single, who is not having immediate sibling, and the pattern and the child who has a sibling,
Hmm.
okay, in a development in a long run, adolescence pattern, or in an 10 years, 11 years, 12 years, that development, it's there is no change in that. There
Okay.
is absolutely no change.
Okay.
Okay, because they have given few reasons for it.
Hmm.
First reason is now every child, most of the child, okay, we have a good amount of schooling going on.
Hmm.
So it's not that child sits at home.
Hmm.
So both the child, if they have a two child, they are going to go to school. What amount of time as a sibling they are going to spend together is very minimum. It's not that 24 hours, 365 days they are together and have a bonding. No. So there is no difference at all. Absolutely
That's
not.
really
No
good
difference.
news.
Yes.
Thank you so much.
Yes, there is no difference.
Okay, understood. Okay, there is one Sanchita Bhar who says, my son is 8-year-old and he shows full of anger in every activity. I think he shows a lot of anger and aggression in every activity. Just 1 second. Sanchita, I'm going to unmute you. Yeah, Sanchita.
Yes, ma'am.
Yeah, hi. You can just address your question directly with Dr. Chetan.
हाँ मैम, एक्चुअली क्या है ना, वो बहुत ज्यादा गुस्सा करता है, मतलब हर एक चीज में उसका गुस्सा रहता है। ऐसा नहीं कि पढ़ाई नहीं है, पढ़ाई में अच्छा मार्क्स लाता है, सब कुछ ठीक है, लेकिन उसका गुस्सा बहुत ज्यादा है।
मैम, उम्र कितना है बच्चे का?
8 में आया है अभी।
8 साल का है। ओके, आप गुस्सा बोल रहे हो, उसके बारे में मतलब गुस्सा मतलब क्या करता है? व्हाट ही डज?
मतलब स्कूल से आता है, जूता इधर उधर फेंक देता है, फिर बुक्स फेंक देता है, फिर कुछ भी बोलते हैं तो कुछ भी मतलब उल्टा पुल्टा करता रहता है।
तो ये पहले से है या अभी अभी आपको ये उसका गुस्सा दिख रहा है?
जितना टाइम जा रहा है ना, उसका ये एग्रेशन ज्यादा हो रहा है।
ओके, जब ये 2 साल में लॉकडाउन में घर पे था तभी भी गुस्सा था?
तब इतना ज्यादा नहीं था, मतलब अभी थोड़ा सा स्कूल चालू हुआ उसके बाद ही उसका ज्यादा हो रहा है।
तो मैम आपको है ना, स्कूल में आप स्कूल में भी एक बार टीचर से थोड़ा बात कीजिए, क्योंकि बहुत बार क्या होता है कि स्कूल में बच्चों का बुली होता है। सो वी डोंट नो कि उसको कोई बुली कर रहा है, चिढ़ा रहा है, या उसके अगेंस्ट कुछ कोई कर रहा है। तो छोटी छोटी चीजों में भी बच्चों को बहुत बुरा लगता है। बहुत छोटी सी चीज है।
एक्चुअली क्या है ना, हम लोग स्कूल में भी गए थे तो स्कूल में टीचर उसको इग्नोर करता है, मतलब वो ज्यादा क्वेश्चन करता है तो टीचर उसको इग्नोर करता रहता है।
तो
तो
क्यों इग्नोर करता है टीचर इतना?
वो उनका ये है कि वो अननेसेसरी क्वेश्चन करता है, मतलब वो पूछता रहता है कि इस पेज में लिखना है कि दूसरे पेज में लिखना है, ये सब पूछता रहता है ना, तो उसका टीचर को अच्छा नहीं लगता है तो इग्नोर कर, मतलब वो सारे क्लास में उसको इग्नोर करते रहते हैं।
मैम, प्रॉब्लम भी है और कॉज भी आइडेंटिफाई हो चुका है, तो वी हैव टू वर्क ऑन दैट।
हाँ, लेकिन उसका मार्क्स मतलब इंग्लिश 80 में 79 उसका मार्क्स आता है, फिर भी टीचर लोग इतना इग्नोर करता है। मुझे समझ में नहीं आता है क्या करूँ उसके लिए।
मैम, स्कूल में काउंसलर है?
हाँ है।
तो एक बार काउंसलर से बात कीजिए ना इसके बारे में।
ओके ओके ओके।
तो हेल्प, उसको स्कूल में हेल्प मिल जाएगा।
Okay, I'm going to unmute Dr. Aksha Banu.
Hi, ma'am.
Hi, Dr. Aksha. Yeah, please tell us.
Regarding my son, he's 4 years old. He's not giving concentration in studies, but he's very sharp in other things. All things is remembered very well. But that A, B, C, D, 1, 2, 3, how much I'm trying to, fix in his mind, it is not fixing. I don't know what the reason and why. And he's very hyperactive. He won't concentrate and sit in one place. He just
Ma'am,
keep
what's his age?
4 years now, 4 years,
So
1
what
month.
do you expect from a child? Absolutely, he's doing good things. He's good in studies. What, he doesn't sit at one place because you want him to sit at one place. Why you should want him to sit at one place? Let him explore.
Why he's not? Because in his same age people, they are studying very well. But my
That comparison, don't compare. Your child is best. He is unique. He is different. Believe in that.
Yeah, but like remembering things, how I have to, like remember the things to fix in his mind, like 1, 2, 3, how to remember and all, like any idea, because I'm getting so much frustration. Even teachers are complaining, you make him sit, make him practice and all. 2 hours if I take also, he's not going to.
Even if you take 5 hours, he will not going to do it. Ma'am, give him time. He's only 4 years. Out of that 4 years, 2 years of his have been in the home.
Yes.
So try to understand the amount of energy which is in the child, which has been just suppressed by this pandemic. And then when we started to go to school, and then everyone wants to get into that fix in that borders, four walls, to study, to write, to learn, to remember, to memorize, and to do what we want, what the society wants, as the parents want. This is absolutely wrong. Give your child some time. Okay, he will definitely come out of this, and he will get himself better. Don't, if you point it out that yes, you have to do that, then the things will get more worse. See, schools will always complain. They, teachers, if they cannot handle, they have a pressure, because as you know, everyone has targets. So they also have a targets, academic targets. Even in junior, senior, nursery, they have academic targets. So they will always complain. Okay, accept it. Just accept it. Tell them, yes, we are working, and be happy. Don't pass on your child when you come home, the teacher is complaining, you are not doing this, you are not doing that. Don't do that. Okay, let the teacher complain. You believe in your child.
Okay, because I need psychologically, because he's doing like that, no. So
you know, Dr. Aksa, if I can just add here, you know, your son is now 4, so the between the age of 1 and 3, he has undergone the pandemic, right? That was the time we were all at home, right? With COVID. Now what has happened is, in his time where he could have been curious, where he could have explored his environment, he could have, you know, seen the world, unfortunately he has spent that time indoors. And now, because he's 4 and he's going to junior KG or senior KG, we suddenly want to tell him that before this pandemic happened, life used to be like this, where we all went to school. You have not done it, but now you have to do this. He's not ever been exposed to school life. This is the first time he's going to a proper school. Give him some time. This is like, you know, Dr. Chetan was saying, this is may just be because of COVID. He spent a lot of time at home, and he's not learning, picking up those cues from his environment. It'll take some time.
Ma'am, believe in your child.
Thank you.
Just 1 minute. Okay, we have a question from Priyanka. I don't know how Priyanka is around. Priyanka, I'm going to unmute you. Yeah.
Hello.
Hi.
Yeah,
Hello.
hi. Thank you. Yeah, so my worry is, and this is not something that I have noticed very recently, but my elder one, since past 3-4 years, it seems like a struggle to keep him happy. I live in a family where my mother stays with me. My husband is around. I would say we are pretty okay to provide him with the things that he wants, including the toys, um, or cycle, or the sports equipment that he wants. He has everything, and it's not that he's not happy. He's happy also at times, but minor things like if we are asking him to get ready fast because the bus is coming, or things like if you're saying don't play PS right now, please play after you finish your homework, he gets so sad as if something really bad has happened in his life, and he's almost on the verge of tears. And when we try to, and I have even tried to sit him down and talk to him about it, that, you have pretty good life. Why are you getting upset? And there will be struggles ahead in the future. But it just doesn't seem to work. He's okay for a few days, and then it's back to that.
Yeah.
So how can I cope with that? He's 11.
11.
Just turned 11.
Just turned 11. You said you have 2 child, no, ma'am?
Yes, the younger one is 4 years old.
Okay, and the things of this tearful and extremely sad you are explaining of 11-year-old child, right?
Yes.
Okay. And this you have observed since 3 to 4 years?
In fact, even before, he has been prone to sulking a lot, always. He has been a sulky child all through. But yeah, this has become more prominent now, because in youngsters, we sort of expect that nahi man ka ho raha, they will crib about it. When they get a little older, we sort of expect them to understand things. And that is something that I'm not seeing him grow to that level. So it has always been there, but now it seems more prominent to us, as I would say.
Okay, ma'am, 3 to 4 years, that means how he is behaving with your younger child?
Oh, he loves him a lot, but he would take responsibility of him when we are around. He tries to show us that he's being very responsible towards him. Rather than being the loving elder brother, he'll be like, shall I feed you? Shall I take care of you? Kind of a thing in front of us. But when they're alone, he plays with him and he's happy with him. And when they go to play together in the ground, he's always very protective about it. But he tries to sort of show us that he's taking a lot of responsibility. When we know jab actually khelne jata hai, to he's protective, but he's not always there, kind of a thing. Yes,
Okay.
he's a kid after all.
Ma'am, if he's sad, if he's tearful, and then if you talk to him, you said that he gets okay for 1 week, and again the same thing continues.
Yes.
Right? Yeah. So I think nothing to worry. But this tearfulness or sadness, if it is consistently there, okay. So consistently means even after your interventions, if it is there, then I think somewhere both the kids, like 11 years old and a 4-year-old, if together you can talk to them together, not I like 11-year-old separately or 4-year-old separately, because I don't know, because I've not have seen them, but there might be a pattern, because when your 4-year child has born, and then somewhere what happens is the parental attention goes towards the younger one more. Okay, you might have struggled to give him more attention, you might have balanced it, I really vouch for it, but there might be some kind of an resentment or anger, like not sibling rivalry, but yes, somewhat of strain, because parents were not able to give that undivided time to your 11-year-old. So that might be the reason, and he's expressing it through the tears or through the sadness. So come out with the solution that talk his problem in front of your younger child, also talk together, so that he will feel safe and he will feel equal, that you are equal to him and your 11-year-old and 4-year-old.
I'm going to unmute Dr. Gauri.
हेलो.
Hi, Dr. Gauri.
हाय. मेरा एक्चुअली एक क्वेश्चन था. मेरा बेटा 5 साल का है और मेरी छोटी बेटी है 10 महीने की. तो जब से वो हुई है, उसका ऐसा कहना है कि सब मुझे ही काम बताते हैं और वो इनसिक्योर फील करता है. तो हाउ टू मैनेज दैट? जैसे हम बोलते हैं वाइप्स लाओ, डायपर लाओ, थोड़ा सा एंगेज करते हैं उसे.
मैम एंगेज करो, लेकिन बच्ची के लिए मत करो.
नहीं, दोनों का बॉन्डिंग भी बढ़ना चाहिए. और कैसा मतलब वो टैंट्रम्स कर रहा है इधर उधर, या खेलने में उसे चोट लग जाए, तो हम उसे बोलते हैं थोड़ा सा कि हेल्प कर दो मम्मा की, तो वो नहीं सुनता है. वो बोलता है, सब चिढ़ जाता है, बोलता है कि क्यों सब मुझे ही क्यों बोलते हैं काम.
मैम सही तो बोल रहा है.
हाँ, सही
बोल रहे हैं आप उसको. हाँ, इतना काम बोलोगे तो
नहीं, ये तो थोड़ा थोड़ा ही है ना.
नहीं, वो थोड़ा आई थिंक कंपटीशन भी तो हो जाता है ना. इन हिज माइंड ही इज थिंकिंग कि एक तो ये नया बच्चा भी आया है और इसका काम भी मुझसे ही करवा रहे हैं थोड़ा थोड़ा, तो इट इज आल्सो पावर स्ट्रगल.
या तो मैम आप उसको रेस्पॉन्सिबिलिटी दीजिए, लेकिन उसके काम की रेस्पॉन्सिबिलिटी दीजिए, या आपके काम की रेस्पॉन्सिबिलिटी दीजिए, खुद के, न कि आपके 10 महीने के बच्ची के उसकी सिबलिंग की रेस्पॉन्सिबिलिटी मत दीजिए. उसको ये रेस्पॉन्सिबिलिटी है कि सिर्फ खेलो, उसका ख्याल रखो बस. मतलब आप मत बोलो उसको कि ये लाओ या ये उसके लिए करो. आप बोलोगे तो प्रॉब्लम है, आप नहीं बोलोगे तो वो ऑटोमेटिकली करेगा एज अ केयर.
ओके सर. और एक्चुअली वो पढ़ता भी नहीं बिल्कुल, मतलब जितना होमवर्क दिया है उतना ही करेगा बस. 15 मिनट्स में होमवर्क फिनिश, 1 पेज दिया है 1 पेज, लेकिन हम रिसाइट करने बोलते हैं, रिकॉल करने बोलते हैं, नहीं. डोंट टॉक अबाउट स्टडीज, डोंट एवर टॉक अबाउट स्टडीज. ऐसा है, होमवर्क दिया है, मैंने किया बस.
मैम बड़ा हो गया, अच्छा बनेगा.
इट्स नॉट अ गुड थिंग, क्योंकि फिर स्कूल में बोलता नहीं है. यहाँ सब बोलता है, स्कूल में कुछ नहीं बोलता. टीचर कंप्लेन करती है कि ये कुछ बोलता नहीं, आंसर्स नहीं देता. और जैसे एक ओरल एग्जाम होती है, अभी तो KG2 में है, ओरल एग्जाम्स होती है, तो उसमें भी इसे सब आता है, लेकिन स्कूल में कुछ नहीं बोलेगा. टीचर ने थोड़ा सा बोला कि स्पीक लाउडली, तो उसके आंख में आंसू आ जाएगा.
Oh, okay, okay.
Okay.
हाँ, तो बहुत रोता है.
So there's
इतनी
one more such question, basically that they talk at home, but the minute they are in school or in an external environment, they keep completely quiet.
Yeah.
So,
So
what could be the reason for that?
this is, this is known as selective mutism. So the child always prefer to talk to the comfortable environment
Yeah.
because the environment is new. He or she is not able to adjust to that environment. मतलब वो डॉक्टर गौरी आपका बच्चा है ना, वो 5 साल का है ना,
हाँ 5 साल का है.
वो एडजस्ट नहीं हो पा रहा है उस एनवायरनमेंट पे. मतलब जब बात करेगा तो उससे वो एक एंजाइटी है या फियर है कि क्या होगा आगे, बिकॉज टीचर है ना, तो एक ऐसे इमेज है टीचर्स का, तो वो एक उसके माइंड में सेट हुआ है, तो वो ब्रेक करना है. तो वो ब्रेक करने के लिए द बेस्ट वे इज टू टेक द हेल्प ऑफ द स्कूल काउंसलर, सो दैट ही विल बी इंटरमीडिएट, ही और शी विल बी इंटरमीडिएट बिटवीन द टीचर एंड सच चिल्ड्रन. तो वो ब्रेक होगा, वो बैरियर ब्रेक होना चाहिए. लेकिन अगर ऐसा होता भी है ना, तो उसको रीएनफोर्स मत कीजिए. मतलब अगर ऐसा होता है तो उसको ये मत बोलिए कि आपको बोलना चाहिए था, आपको बात करना चाहिए था, आप घर पे बात करते हो, उधर जाके बात नहीं करते हो, ऐसा मत कीजिए. उसको एक्सेप्ट कीजिए कि इट्स ओके इफ यू आर नॉट एबल टू स्पीक इन फ्रंट ऑफ टीचर्स. आई एम वेरी हैप्पी दैट यू आर एबल टू गिव द आंसर्स इन फ्रंट ऑफ मी. अगर आप मेरे सामने आंसर दे रहे हो, इसका मतलब आपको आ रहा है और वो मुझे चाहिए, आपको आना चाहिए, न कि टीचर के सामने अगर नहीं दे रहे हो, मार्क्स नहीं मिला, इट्स ओके, बट थिंक अबाउट इट. तो ऐसा थोड़ा एक पॉजिटिव एनवायरनमेंट क्रिएट कीजिए, एंड देन दैट विल हेल्प हिम टू, ही विल ओनली फाइंड आउट सॉल्यूशन टू टॉक टू द टीचर.
ओके ओके सर.
ट्राई दिस आउट.
ओके ओके. एंड वन मोर थिंग, जब वो वैन से जाता है स्कूल तो बाकी के बच्चे मारते हैं, इंस्टेड ऑफ डिफेंसिंग वो खुद को प्रोटेक्ट भी नहीं कर पाता. डिफेंस तो दूर की बात, मार खा के आ जाता है.
वो 4 साल का है ना?
5 साल का है.
मैम ऐसे कैसे मार?
तो ये तो स्कूल को
हमने-
हैंडल करना चाहिए.
हाँ, हमने
स्कूल बस
स्कूल में भी
में
बोला. वो बोल देते कि हम इसको अलग बिठाएंगे, जिसने मारा उसको डांट देंगे, बस. लेकिन उसको हम घर में भी सिखाते हैं, किसी ने मारा है तो एटलीस्ट खुद को प्रोटेक्ट करो, मत हाथ उठाओ, लेकिन खुद को प्रोटेक्ट करो. तो वो भी नहीं करता.
मैम आपको इंटरवेंशन करना पड़ेगा,
Yeah.
आपको बात करना पड़ेगा जो ड्राइवर है, वैन है, स्कूल है, कि मारना अलाउड नहीं है, बुली है. उसका भी एक रीजन हो सकता है कि उसका पूरा, मतलब स्कूल पे पहुंचने से पहले ही वो अगर ऐसा मार खाते जाएगा तो वो उसका पूरा कॉन्फिडेंस और एटीट्यूड ही चेंज हो जाएगा ना स्कूल में पहुंचने के बाद. तो ये आपको थोड़ा सा इंटरवेंशन बात कीजिए सबसे पॉजिटिवली कि ये ऐसा नहीं होना चाहिए, प्रिवेंशन कीजिए. मतलब
I think 4 या साल, 4 or 5-year-old child is very young to defend himself.
Yeah.
What is he going to do? He's not going to do karate and stop someone from hitting him. You have to stop the issue, which is physical violence in the bus. That is a
Ma'am,
completely unacceptable
start
thing.
giving official complaints.
Yeah, absolutely. Okay, we'll just take one last question. I know we've run out of time now.
Yeah.
There is hi ma'am, my child is 3.5 years. He tries to please people by trying to attract their attention. Is this normal?
Absolutely normal.
Everybody wants to be loved and accepted.
even adults do that.
Yeah. Okay.
It's absolutely normal.
Okay, I think we'll wrap up this session. I think we've covered most queries. Thank you so much, Dr. Chetan, and hope we
Thank
can
you.
trouble you again in the future
Sure,
with
sure.
a few more sessions. Thank you everyone for joining and have a lovely day.
Thank you.
Thank you. Bye.
Bye.